Hello and welcome to the CDO Magazine interview series. I'm Dave Mariani, CTO founder of AtScale, and we're partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. And today I have the pleasure of talking with Omer Awan, Chief Data and Digital Officer for Atrium Health. Omer, you have a pretty amazing background in the healthcare industry. You've been part of that industry for quite some time now. So great to meet you, first of all. Obviously, a lot of organizations are moving their data and analytics stacks to the cloud and taking advantage of some of the cloud infrastructure. Is there anything different in healthcare? Is healthcare sort of a little more careful about moving to the cloud, or is that something that is an old idea and we've moved beyond those concerns?
No, I think it's the latter, what you just said, David. There was a time, I remember many years ago, that I would talk to many of my peers and friends, and they would be very reluctant and would rather have, and felt more confident and safe if the data was within their data centers and cloud was a no-no. But that has changed, dramatically with the cloud being so secure. And we have actually been moving towards the cloud for about a year and a half, 2 years now, and pretty much really going to visual data centers and trying to move everything to the cloud. So that is, and that's not just with our healthcare system, that is the journey that almost all healthcare systems are moving towards the cloud, because there's immense value beyond the cost itself. So.
Very good. Yeah, that's definitely a trend that we're seeing as well. Part of your title, Omer, is digital officer. What is digital transformation in healthcare? What's that mean to you? What's that mean to the audience? What does digital transformation in healthcare mean?
Yeah. So so it depends. I think it's almost become a cliche right now, right?
Mm-hmm.
AI, ML, digital transformation. And I think digital transformation to different organizations may mean different things. And it all depends on where you are in your journey and what are your goals and objectives. And so that defines the path. So we have been, everyone, they define it differently. In our organization, digital transformation really means quite a few things. It means a gamut of strategies that we are executing in tandem to get our organization to a certain point. And it's a multi-year journey for us. Like you mentioned, the cloud, moving to the cloud is one of our goals within our digital transformation strategy. We are a large healthcare system spread over different states. And one of the other one is to make sure that we have a unified single EHR, electronic health record. And that's part of the other piece. Hand in hand goes your ERP system. So we also want to make sure that we have a single unified ERP system. Virtual health is a big piece for us, especially with the pandemic. We have seen unprecedented growth. And we don't expect the pendulum to swing back anytime soon. I think it's only going to keep moving forward. And so virtual health is an important piece of our solution offerings that we have and a key part of our digital transformation. Consumer is at the heart of everything that we do, our consumer interactions. And, when you talk about the consumers, you're talking about these the user people who are using Amazons and Apples, right? So they and that's another thing. So making sure that the kind of service or the level of convenience that they have come to expect from other organizations, that we bring that to the forefront for them. So continuously working on consumer experience in close collaboration with our marketing, communication, and consumer team. Those are some of the, and then I think another big one is predictive analytics, which is it goes back to what we were talking earlier about really how do you take data to the next level? How do you take this data and inform the next best action for our clinicians so that they can focus more on the areas of things that matter the most?
Yeah, it's well, I'm a I'm a big fan of, I got my Apple device, right, my phone, and I used the healthcare app. I was and I synced it with my medical records. I was like really pretty surprised about how much data could be synced. And it's like, I think that consumers are ready for that kind of information exchange. So I'm really glad to see that it's happening, and that we can do that. I think it's going to be better for a lot of people. You touched upon the big, obviously the overarching challenge of the pandemic. And I like to ask this question: is that the pandemic has affected industries and companies in so many different ways, and it seems to be accelerates some trends that are already underway. So what did that mean to your organization and to your job, Omar, in terms of the pandemic? What kinds of changes did you have to implement or speed up to respond to the challenges?
Yeah. So I think the one of the things, so there's several. I think what happened was, I think part of what pandemic did was uncover or brought a lot of focus on some of the areas that we may not have thought about previously, but it brought that and made us look into those areas, and not just us, but across the industry, healthcare, lifted the cover on some of the things that are there and brought focus to it. And then, so for instance, one of the things I'll share with you is that when we talk about, like I was mentioning about virtual care, what we saw was that the COVID-19 pandemic exposed the mental health crisis that our nation has long been facing, and sadly the inadequate resources we are devoted to it, a combination of provider shortages, inadequate insurance coverages, the social stigma. All those exacerbated the dire situation. So, but from a virtual health perspective, we can leverage multiple technology options, including things like chat, messaging, phone, and video. And then, if I recall correctly, American Hospital Association, according to a research or study, they had said that something like 70% of behavioral health providers reported that they plan to continue offering telehealth services post-pandemic. So there's an immense promise there, you see, with virtual health in those areas. The other example we have seen with the pandemic across is the heightened attention to health equity. And right, so the COVID-19 pandemic, it put like a spotlight on our nation's pre-existing health disparities. Black, Latino, Indigenous people suffering and dying disproportionately, and all of us, are aware of the racial disparities in the maternal health space. But here, data analytics is a very powerful asset, right? And it can single-handedly uncover organizational performance and have any gaps. So those were very key. Lastly, we saw in our organization, we really saw virtual health, or if you call it telehealth, really come to full swing like never before. And especially because of the social distancing and other pandemic-driven requirements, patients and clinicians preferred virtual health as much as possible. So, and then people soon realized that virtual health is a lot more convenient. And this is, as I mentioned before, it's just a trend we don't expect to go away anytime soon. And then as a result, not just in our organization, we really started seeing an emergence of virtual care solution across the continuum, from telehealth visits to virtual hospitals, home-based care, and remote patient monitoring, a lot of the things. I'd like to share something which I found very fascinating, some stats from American Hospital Association, which are really thought-provoking. And they did a study, and they shared that health systems believe that up to 40% of primary care visits could be done via virtual visits.
Hmm.
They also shared that the willingness to use telehealth by
Hmm.
patients has actually increased to 66%. I mean, this
Wow.
thought provoking. 66% of patients are willing, and this is by far the most interesting one. And this is they shared that in February 2020, less than 1% of Medicare primary care visits were conducted via telehealth.
Hmm.
By April, driven by the pandemic, the volume had risen to 43%. So from
Wow.
less than 1% in just a few months to 43%. So, this is unprecedented growth. It'll continue to happen. We have seen it. We were so glad that we had a program in place and we just took it to new heights there.
Yeah, that's a look. I'm a big fan of telehealth. Just this week, my wife, used it because she had a cold that wasn't going away, and it wasn't COVID for once. And it's amazing that you think about trying to get an appointment is enough of a barrier that would prevent me at least from going and see the doctor. But if I know I can see a doctor like almost instantly via telehealth, that's a game changer. And when you think about the cost of delivering that service, that's also a game changer. So to me, that's like the one of the biggest benefits of digital transformation is what you call virtual care or telehealth. I just hope that more people can find out about it and take advantage of it because it is a game changer.
Yeah.
So this has been a fantastic conversation, Omar, and you've got you got so much experience here, and you've pointed out some really major trends. I always like to sort of close these conversations with the future. So I want you to put your future hat on and try to predict what's going to happen in the future when it comes to data and analytics. What do you see as the big trends out there? What do you think is going to happen in the near future here that are going to affect people's lives?
So there's you're asking a person who is more in the data space. Obviously, my answer to that is going to be more data oriented. And then when you
Right.
talk about that, we kind of
Yes.
go back to David, what you were talking about. I think there's a lot of exciting things happening from a technology development that have implications in the healthcare space. But I still believe that no other technology has more promise than AI ML.
Mm-hmm.
Because one of the things, I mean, we know this is that in healthcare, the patient data, it continues to grow. It's growing at an unprecedented rate. So you talked about the Apple phone. We're talking about Internet of Things. People are doing these wearables. It's not just the data is not only generated now within the four walls of the hospital. It's
Mm-hmm.
also those other devices. And for the clinician to really have a 360 view, they need to have a full picture. And a lot of the stuff that's important really may not be part of the patient chart. It's happening outside. And
Right.
so bringing all that data, I mean, there's tons of data there. And when you're looking at all through the data, it's not humanly possible to go through it in a very traditional way. You have to rely on technologies like AI technologies to really bring to the top for the clinician to what to zero in on. And we're seeing the advancements that we've seen in the radiology space, how AI is really revolutionizing and quickly scan through the images and make it easier, facilitate the diagnosis, the preliminary diagnosis and analysis for the radiologist. I think that's the future, at least in healthcare, is how do we garner insights from the data that is there and bring forward for our caregivers so that they can proactively um, act upon those insights and not retrospectively, but how can we inform the next best action? I mean, that's our goal so that and make it easier. And there's a lot of promise there. We just need to make sure that we continue to develop those solutions.
Yeah, that's great insight that there's so much more data outside of the four walls of the hospital or your institution, and that's really the key. And you apply AI and ML to it, and you could start to actually predict and help people before they actually may even have symptoms or get sick. Omar, it's like just to summarize a little bit, we talked a lot about the hub and spoke model. I love that. You talked about how important it was to have a data and analytics strategy, and all the different pillars of it. I liked you talked about your maturity model for charting your course and how important the cloud was, and this talking about digital transformation when it comes to things like virtual care, virtual health, and of course, incorporating AI and ML to help predict the future. So, Omar, this has been a great conversation. I want to thank you for joining me today. And to the audience, please visit cdomagazine.tech for some additional interviews. Thank you, Omar.
Thank you so much.